welcome back. I'm Angie, and this week I have a few more questions for the Q&A series that were sent in. This week I'm answering whatever questions you sent in, mostly about medications this week. So the first question I have is, do I have to take medication to get better? No, not necessarily. You don't have to. Sometimes medication isn't even a good or appropriate course of treatment for you. You may not be a candidate for medication. It just depends on what you and your provider talk about, what your symptoms are, what your goals with treatment are, and that type of thing. So medication, you don't always have to take medication to get better. So sometimes it's about setting boundaries. Sometimes it's about a different environment. Sometimes it's about, changing our job or our career that can be super stressful. Sometimes it's about diet and lifestyle situations, right? Sometimes it's about better sleep. So you don't always need a medication in order to feel better. That being said, I don't like to prescribe medication if we aren't changing anything else, right? We're not supposed to take a pill to mask what's going on at work or at home or in our life, or to make up for a bad diet where we're not getting enough nutrients to produce the right amounts of serotonin and dopamine in our gut to get to our brain, right? So medication, do I have to take it to get better? No, not always. It just depends on what's going on and what you're willing to do too. Again, this is your life. So a lot of times when people come to me and they're very hesitant to start medication, we talk about what makes them hesitant and what else we can do that isn't medication related that could help boost mood or decrease anxiety or improve sleep and help them feel more like themselves. So medication isn't always an answer. It's a tool that we put in our toolbox that we can utilize, but it's not always an answer. And I personally don't like to use it as a band-aid if you have a horrible job or a horrible relationship with your parents or your significant other or your kids or whatnot. Those are the things we need to address. The pill's not going to get rid of that or eradicate that for you by any means. Next question is, will psychiatric medication change who I am or make me a zombie? Ooh, that's a good one. I hear this a lot. I don't want to change who I am. I don't want to be a zombie. I don't want to feel numb. And I 100% agree. If a patient and I decide that it is the time to start a medication, then we always talk about side effects, right? Side effects are a big thing. Psychiatric medication is no walk in the park. There are side effects that you can get from that carry on long term. So if we can do other things to help you, by all means, let's do them. But sometimes we've tried all the things and our brain chemistry just needs a little extra oomph, at which point they can be helpful. However, I always tell people medication should not change who you are. If you feel like you are numb, you can't access your emotions, you feel blah, people around you tell you that you're moving really slow or you're just very zombie-like, then that's probably not the right medication or dose for you. So I personally like to follow that pretty closely. I want to make sure that we're still engaging in things, that we're still active, that we're still able to feel like who we are, essentially. So it should not, in my opinion, it should not make you feel those types of ways in a negative way. I always tell people it's supposed to help you feel like you just a little bit improved. So that was a good question. The next question is, am I weak for needing medication, and will I be on medication forever? First of all, I don't think anyone's weak for needing medication. We use antibiotics, we use heart medication, we use insulin for diabetes. We use medication as a tool for a lot of different conditions in the medical world. And psychiatry really isn't that different, right? Our brain doesn't live in a silo. Our brain and body are in one centered unit, right? So we can't treat them as so totally separate. I feel like that's really unfair. And I think that's probably part of the reason why there's such a stigma around mental health, right? Because we don't talk about the people that go to the ER with their third and fourth heart attack, or that go to the ER because their blood pressure's so high, or they have another migraine this month, right? Those are all valid medical concerns. However, for some reason, we have this stigma around like, oh, you're depressed, oh, you're sad, oh, you're self-harming, right? So those feelings don't live in a silo. It's part of who you are, and it should be treated as such too. So are you weak for needing medication? No, not by any means. Medication is a great, fantastic tool when used appropriately and can absolutely be helpful and beneficial to help people get back to feeling like themselves. And will I be on medication forever? I think that depends on what's going on. There are some conditions where you probably will need some type of medication support long term, but for the most part, if you're coming in with some mood disorders, depression, anxiety, ADHD, things like that, you don't always need lifelong medication. There are a lot of things that medication will help you feel more in control, more like yourself, more empowered, which is the goal, right? And while you are feeling a little bit better, you're working hard on, therapy, coping skills, setting boundaries, doing things that you can to increase or beef up your work and social support, creating space for yourself, taking better care of yourself, because you don't want to go back to how you were and the life that you led before you came to see a provider, right? Because that's what led you to see a provider. So the goal is that if you do need medication and you do take it, that hopefully you will, in the meantime, be working on building some skills and building a better life for yourself, one that won't run you down, or one that you won't feel a need to escape from, so to speak. So I hope that answers that question. Can I get off medication once I start? Sometimes yes. Sometimes these as needed medications, you don't need them for a lifetime. They're there if you need them, but you don't need them. Even antidepressants, I don't consider antidepressants a lifetime medication. I always, when I talk to patients about it, it's if you need some extra support with your brain chemistry during this time. And then again, we're going to beef up your coping skills. We're going to help you make changes in life so that you don't come back feeling low and run down and overwhelmed again, that you feel more in control, empowered, and feel that you have more clarity around decision making in your life, so that you won't need these in 6 to 9 to 12 months typically. And then we start talking about getting off of them, because they're not meant really to be lifetime medications. So that's my personal opinion. I think a lot of providers do feel that way as well. We don't want you to be on meds for the rest of your life. We're here to help you during a difficult time in life and help you get back on your feet and back to feeling like you want to feel again. And then you don't need to see us as often, right? That's kind of the goal, is to help people feel better so they don't need that interaction as often. I'm scared of becoming dependent. Is that real? Yes, 100%. I think that's a very valid concern. A lot of people, there are a lot of horror stories. I myself have read them. I have seen them in practice as well, right? I mean, if you come to me and you've been on a medication for 15, 20 years, it's going to be a lot more difficult to get off of that medication. Can it happen? Yes. You're going to have a lot more side effects coming off of it. However, if we can treat you and help you kind of build you up, if you, so to speak, right? If we can help build you up and support you during this time where things are really difficult, and then help you again with the coping skills, with recreating a life that you don't need an escape from, with recreating a life that you enjoy, that you feel motivated, that you look forward to. Those are things, when those are in place, then the medication can kind of peel away and take a step back. So I like to get people off medication, even if you need it for a year or 2 years, that's okay. There's no wrong answer here. But if you need it, that's what it's there for. We wouldn't hesitate to take an antibiotic, right? We wouldn't hesitate to take a medication for pain relief or inflammation if we had a burn or a broken bone or things of that nature. And our brain is really no different. When it gets really overwhelmed, bogged down, and really just kind of functioning at a low, minimal level, sometimes we need a little extra support. And that's what this is. Supplements and medication, both, as well as diet, lifestyle, social support. There are many, many things that can contribute to boosting mood, decreasing anxiety, supporting good sleep, supporting health, motivation, the ability to look forward to things in life. So it's not just medication, but yes, I get a lot of that. I'm scared of becoming dependent. That is very real. And that is something that I like to talk about in depth if we are starting a medication that you will need to be on longer term. I like to be very transparent up front with that. Again, in outpatient psychiatry, usually you are the one seeking an opinion, and it's up to you if you choose to agree with that opinion or not agree with that opinion. If you want to take the medication or not want to take the medication, I'm not here to judge you. My role is to just educate you on your options, and your role is to decide what's right for you, what's realistic for you in your life. For some people, medication isn't an option, and that's okay. There's lots of other things that we can do in the meantime to kind of help get you feeling better as well. How do I find a provider? What if I don't like my provider, or if I don't connect with them? A lot of times, if you're using insurance, your insurance company has a list of people that are credentialed with their company, and you will have to utilize them. If you don't care about using insurance, you want to do private pay, that's a different option. You need to look for someone who is licensed. You can check their licensing with the state that you're in, with the medical board. You can always look at reviews. I'm kind of 50-50 on reviews online, because It's kind of like if you look at reviews of hospitals, not a lot of people want to be there. Sometimes people don't want to come to their psychiatric provider, whether that's therapy or a nurse practitioner or psychiatrist, but it's necessary. So use your judgment with that. I always say, go in looking for someone who is licensed and credentialed in their state, that has experience treating the things that you are looking for help with, and hear what they have to say. If you don't like what they have to say, you don't have to go back. There's no law that says that. There's no ruling that says that. In very, very limited cases, you would have to continue to see the provider in like the case of a court order or something. However, 99% of the time, you don't always need to go back and see the provider. I think it's important to find someone that you connect with. Sometimes it's helpful for you to go in with a couple of questions about things. Do you have experience with this? Have you treated X, Y, and Z before? What's your approach to that? Do you include lifestyle and supplements? Do you include labs? Do we talk about medications? Do you do any kind of therapy, right? These are all important questions to ask your provider and just get an idea of what's going to be helpful and beneficial for you. I myself, when I was looking for a therapist early on, I went through a few therapists because I just didn't connect. After that first meeting, I felt it just wasn't there. Either I felt I was being judged, or I felt maybe they were in over their head with what I was coming to them with, or they didn't have experience in it perhaps. But asking those questions about their experience, how they approach it, how often do you need to see me? Do we talk about supplements? Do we talk about diet? Do we talk about labs? What about medications? What if I only want to be on them short term? What if I want to get off of them? And do you prescribe medication? These are all important questions to ask. And if you don't agree with it, that's okay. There's nothing wrong with that. You just didn't connect. So you find someone else and go to another consultation. So that's not something that people take personally, but as you person seeking help, you need to make sure that you connect with that person on that level. So, and myself included, I've had doctors before too that I'm just like, no, it's not there. It's not happening. I gotta find somebody else. And that's okay. Sometimes it takes a few people and it's frustrating, but that's the world we live in, right? So I just encourage you to find someone that you connect with, that you feel safe with, that you feel has experience and can kind of set your mind at ease in dealing with the issues in which you're coming to them with. Because if they can, or if they're like, I don't know, or I can reach out, or I can find these things, then maybe find someone who has experience, who you feel has a level of confidence in discussing that with you. So how do I know if I need therapy, medication, or both? Great question. I think it's important just to go talk to someone, whether it's a therapist or a prescribing provider, it doesn't matter. Just go and talk to someone and see what your options are, right? That's our role, is to listen carefully, probably ask you some questions about medical history, surgical history, family history, that kind of thing, and get an idea of things. And then talk about what are you coming in for help with? What do you need help with? Is your top priority sleep, or is it more mood? Do you feel like your mood is unstable? Do you feel like you have really high anxiety? Do you feel that you have obsessive, intrusive thoughts or compulsive tendencies, right? So it's really important for us to hear from you what is the biggest struggle and how it's impacting your life on a day-to-day basis. Sometimes you don't need medication and therapy is sufficient. And sometimes you do need medication, and sometimes the combination of them both can be helpful. So there isn't a cut and dried answer. I will say, when I am talking to someone, I always like to think I'm taking in this information, asking questions, listening, and I'm always wondering, is this a neurochemistry problem that needs medication to treat the chemistry or chemical components? Or is this a neurocircuitry problem? This is more habits, thoughts, perspective, frame of mind, where medication isn't as necessary. Sometimes you do need both. Sometimes you can't formulate the thoughts or engage in therapy as well if you don't have the chemistry on board. If you're just really low, bottomed out, you're too anxious to even formulate a thought or to even get in to see someone. Sometimes you need a little bit of help with medication, whether that's daily or as needed. That's between you and your provider. But sometimes the medication can kind of help the chemistry part so that you can then engage in therapy. And sometimes you need to start with a therapeutic component and talk about things so that you can understand why the medication may or may not be helpful for you. So I think it really comes down to you being comfortable talking to the providers in your life, whether they're a therapist or a nurse practitioner or a PA or a doctor or a psychiatrist, finding someone that you connect with, being comfortable feeling feeling safe with them, asking questions. And, like I said, if you are unsure about an opinion, I always encourage people to go get a second and third opinion. I think that's the best thing you could do. For me personally, it helps me kind of weed out things if I'm unsure, right? I go to a couple, 2 or 3 experts to see what their consensus is. If they're all saying the same thing, then okay, yeah, now I got to make a decision. But if they're all 3 saying 3 different things, that's even more confusing, right? So I need to make sure that I find someone that I connect with, that I can ask questions, and that I'm not going to feel judged when I ask those questions. And I feel like they're going to answer those honestly for me. And then last question I have is, what if I don't know what to say? Well, the great news is you don't have to think of something to say. If you feel like things are going well, that's great. Sometimes it's nice to talk about the positive things too in your session or in your appointment. What's going well? Because we want to capitalize on that for you, right? What are your strengths? What's going great? And we can use that to strategically think about some of the weaker areas in your life so we can beef them up, right? I don't know if you've seen like that wheel of life and all the different categories in your life with social support and finances and work and family and all of the things in self-care, right? Where are you really strong and where are you weak at? Sometimes you don't have to come in with something bad to talk about. You don't have to come with a big traumatic story. You have to come in with a mood disorder and say, I just really have these horrible thoughts. Sometimes it's nice to just get a different perspective on like, hey, I am really killing it in my relationships, but work, I just struggle. Okay, let's talk about that. Or vice versa. If you're killing it at work and you struggle with close, intimate relationships, whether that's with a significant other or with your kids or with family or with friends or with coworkers, then let's talk about that. What does that bring up for you? So I think the goal of therapy and psychiatry is really to help you feel like the best version of yourself. So please don't worry if you come in and you're like, I'm here and I don't know what I want to talk about. We will find things to talk about. And like I said, it doesn't have to be negative, right? We get so used to bonding over negative things in day-to-day life, right? Especially at work. Oh, we both hate the boss. We both hate corporate, right? Or at home. Oh, I hate my husband. You hate your husband. Great. We hate our husbands, right? Our kids are stressing us out, right? We bond over negative things so much in life. And really, it's more meaningful and these connections last a lot longer in life when you bond over positive experiences, more so than the negative ones, because the negative ones are going to fall away. Most of the time, negative circumstances in your life will not maintain forever and ever. But the positive ones that you build on with other people, those are the relationships and connections that last a really long time. So it's really important that we have that opportunity in our life and also with providers to really talk about, hey, these are the things that are going well for me. These are the good things in my life. These are the positives. And here's a couple weak links, but I feel like pretty good. Your provider, your therapist, your psychiatrist, if you're doing really well and you really don't need our help, then we're going to tell you, I don't know what you want me to do for you. You sound like you're doing amazing. That's great. Then, peace of mind, then you don't need to go forward. That's fine. But sometimes it's nice to talk about the positive things too and learn to look for those, seek those out, and connect with others on a positive note as well. So that's the questions I have for this week. Thank you guys so much for writing in and sending in questions. I will continue to do this Q&A every week. Feel free to drop a question in the comments below. If you would prefer to stay anonymous, you can go to the website down below, alignlifejourney.com, and click on the contact me, and it will come straight to my email. I won't disclose your name or any information, but if you'd like to have your question featured or answered, I'm happy to do so. Please check out our website. And then we also have groups coming up too. The Calm Collective will be starting again here soon. You can check that out on the website, and I'll put the link down below. Thank you so much for joining, and I will talk to you next week.